some African countries are leveraging their capacity to test for COVID-19 as one of the ways of investing in their health systems. CGTN's Daniel Arapmoi visited a football stadium turned into a temporary hospital some 40 kilometers east of the Kenyan capital, Nairobi. It has been set up as part of measures to fight COVID-19.
Frontline healthcare workers and officials in Kenya's Machakos County are turning the local stadium into an isolation facility. Doctors and nurses assemble ventilators and other equipment in readiness for the worst, a possible sharp rise in confirmed COVID-19 admissions.
The Stadia facility and the other 122-bed facilities in our various facilities is going to help us to curb the virus. So we are just planning ahead. So far we don't have a case, but we don't know what will happen tomorrow.
This makeshift facility hurriedly assembled to deal with the dire situation.
If we see numbers are increasing, we'll be able to set up 5 more tents within that stadium to increase the number from 60 to 300 beds. It's doable, and it is a quicker and cheaper way of rather than setting up a whole hospital or destabilizing an hospital to make it a COVID-19 exclusive.
We've had several leaders coming up with structures in order to curve or to prepare itself for the coronavirus victims. The only thing we can do as residents is to support the initiative.
At the main hospital in Machakos, an oxygen supply system has been set up for those who might experience shortness of breath. The goal is to continue its usual services under unusual circumstances.
Coronavirus has put an immense strain on Africa's healthcare systems, prompting governments to build new makeshift hospitals and testing facilities to help contain the spread of the virus.
The pandemic has sent countries scrambling to ramp up testing efforts while maintaining bed space for other patients in their hospitals. With the battle to contain the virus still raging, the frontline caregivers are just not about to give up, sacrificing their time, setting aside their normal lives to attend to those in dire need of medical attention. With the overwhelming healthcare challenges, African countries may need to reconsider bolstering their healthcare systems to cope with the rising infections. Daniel Arapmoi, CGTN, Nairobi, Kenya.